we can use to sensitize the beneficiaries. So that was done to standardize the information that we are sending out there. As I've already alluded, that PrEP is a new intervention. Little is known for most of our people in the country. So we needed to standardize the type of messages that we're sending out there to also avoid conflicting messages as we send out to the people in the communities, because we have multiple role players in the community that are implementing within the priority population. So we had to do that as Minister of Health. And another strategy that we use, it was the use of different platforms or channels to convey these messages. So that included messages that were played as radio, as advert radio, and also talk shows. So we also use social media. We also used TV to send out these messages. And this, especially the radio, where we had a sort of a campaign, it was very helpful, especially in the era of COVID-19, where we had majority of our young people, both the in school and out of school youth, who were in their home because of the different lockdowns that we've had as a country. And we're using this channel because we know listenership coverage is very high in country. Radio is the largely used channel. It's more than 80%. So we knew that if we have the messages out there, they are likely to hear it, especially because they're at home. And also the education, our education program was also using that same channel. So we knew that the young people are likely to be listening because there are also sessions that are being used to also educate them on their formal education. So we had these adverts, we had these talk shows. So that shows that majority of these young people that were listening to that we were able to pick as we saw it improved during this period when we're using this platform, which was widely used. We improved, I think, when we look at our data, because initially we thought after the COVID, as now we are more like normal. So we're having our meetings. We've tried to assess or analyze our data. We thought the numbers were going to be low, but we've seen that there's been an increase of about 40%, especially on the priority population. So we've seen that if we are using platforms which these young people are likely to use, it does give you the results, especially because you want them to improve the uptake of PrEP, because we've seen that we're having new infections coming from them when we look at our recent data. So those are the things that we needed to do to try and address the issue that we're seeing from the recency, HIV recency data. Yes. Yeah.
Wow, thank you so much, Cindy. It's really good to hear your experiences, in terms of demand creation and also engagement of different communities, different stakeholders in terms of a well-coordinated program on the ground, and be able to reach these adolescent girls and young women. The vital thing that we might want to look at is different messaging, and also how do we reach these adolescent girls and young men? What modalities can we use, or a mode of communication can we use? And I'm really glad that you really talked about, the radio campaign, which is really good, because adolescent girls and young men in their variety, radio is one of those things that they do listen to. So really for me, that's really crucial. And for the ministry to really take that front, of coordinating all the messages, because we know communities, they're different, organizations, community-based organizations, that they're running these programs at the end of the day, but we want it to be a well-coordinated program. So really, I really acknowledge and applaud you in terms of coordinating the messaging at the end of the day. So I just want to get back to you, Cindy, as a follow-up question. You've talked about, different platforms that you have been in terms of producing the messaging and also reaching out to adolescent girls and young men, probably through a radio show. Can you try to share with us, probably explain more in terms of the key steps that you take in terms of engagement of critical mass stakeholders, that are contributing to AGYW PrEP programming at the end of the day?
Okay, thank you very much. As a country, before we embark on even developing these messages, we sat down with the stakeholder that is implementing PrEP in the country. So the first step was for us to understand the situation in the country. So we did a situational analysis, which included a research looking at what other countries were doing, and we also triangulated our reports from the demonstration projects. We with that, and then we did some consultation with the stakeholder that is involved in the implementing. It was more of the programmers, so that we can also understand from them what are the facilitators, what are the barriers, what they are seeing on the ground. So after that, we also targeted the beneficiaries that included the priority population. So we had some questions that we've developed where we're collecting information on on this stakeholder, especially the audience, the beneficiaries, where we were looking at what are the benefits of PrEP, what motivates them, what are the social norms, what are the barriers and facilitators, what are the communication channels that they can prefer to get these messages. And once we collected this data, it also included consultations with the healthcare workers, because they're the ones who are delivering these messages. If there are issues that we're not addressing, there are likely to be barriers to the uptake of PrEP. So we also included them so that we can hear their voice, to get their perceptions, their fears. So those were the consultations that we did. And then we sat down and we analyzed all the data from our research, from the consultation with the different stakeholders. So within the different stakeholders, we're targeting people who have used PrEP and they've stopped for whatever reason, people who are currently on PrEP, and also people who are potential users, so that we can get all the information from these different groups. But they were coming from the priority populations, which also included the adolescent girls and young women. So those were the steps that we followed. And then we had a workshop at the end where we sat down and we triangulated all the data so that we can come up with the messages that can be used for the different populations. And what was key is the involvement of the adolescent girls and young women during these meetings where we are crafting the messages, so that we make sure that we use the proper language, we use the tone, we also use messages that they can identify with, not just create messages which at the end they won't be identifying with. So those were the things that we did. And with this approach, for us, we think it was very helpful, since we're able to maximize on the resources that we have, because we had everyone in the room. And to operationalize the development of these strategies, our partners were supporting what needed to be supported in terms of the implementation. Thank you.
Wow, thank you, Cindy, for those insights, really. And I love how you engaged different stakeholders so that we have a comprehensive input in terms of how we are you approached everything in terms of PrEP programming for adolescent girls and young women. Now talking about adolescent girls and young women in terms of the approaches that we can employ in terms of engaging them, and also for them to really access this PrEP. Primrose, you have been working in Zimbabwe, and you have been working with these adolescent girls and young men in their diversity, and we have got different approaches in terms of generating demand for services among adolescent girls and young women, including PrEP. So can you share with us some of these approaches, how you found them to be, most effective in terms of programming? Also looking forward to adolescent girls and young women perspectives as well. Over to you, Primrose.
Okay, thank you, Maxi. So we've really found, in terms of needing to scale up PrEP and the different approaches we would use, that we really needed to make sure we were differentiating the way we deliver PrEP services to adolescent girls and young women. And our particular subpopulation to focus on is sex workers. And the approaches that we use for older sex workers, they weren't the same that would suit these young women selling sex. And even in that age group, they're not a homogenous group. You know, they're those who identify as sex workers, those who are non-identifying. The 15 to 19 are harder to reach than those that are, 22 to 24. So we had to really look at how to use different approaches for a more client-centered approach. And so we did use several approaches, including scaling up telehealth and making sure we're offering multi-month dispensing of PrEP. But looking at what did we find to be the most effective was really the community-based delivery of PrEP. Being able to take PrEP to the adolescent girls and young women, especially in this era of COVID-19 last year, how we would maintain and expand the access was to increase the PrEP access points that would suit them. They had worries about how to travel to the clinic. Sometimes they don't want to be seen at the clinic. You know, these clinics become known as sex workers get treated here, and they don't want to be associated with that sometimes. They had worry about travel costs and also with movement restrictions, how to get there. And they were worried about if they got on PrEP and come back, how would they get their PrEP? So this taking PrEP to them at the agreed meeting points, access points, where they were comfortable to come to, not worried about who would see them getting that service there as well. That really made a big difference in tailoring that approach for them to get PrEP.
Great. And thank you so much for those insights, really. I think it's really important for us to really understand the adolescent girls and young women and their needs and their wants at the end of the day. I love that you also did the community delivery, bringing services to the adolescent girls and young women in their own preferences. Do they want it at a school? Do they want it at a community hall? Somewhere secure for them, somewhere where they feel they are very much comfortable taking up PrEP at the end of the day. And you managed to also address some of the concerns that they have in terms of, continuation of access to this PrEP as well. I think that's one of the issues that we really also need to address. Looking at continuation of programs as well is really critical as well. And there's something that you talked about, the client approach as well, treating adolescent girls and young women in their unique way, whereby you talked about different ages that we have. Because AGYW, they've got different age groups that you could approach them in, and we really need to understand those different age groups at the end of the day for them to have a differentiated service for their own unique needs at the end of the day. So really, I thank you for that as well. In terms of those as well. So I'm coming back to you, Primrose. Going back to the effective approach you mentioned. In terms of community approach, in terms of client-centered approach. Can you share what aspects of implementation was critical for its success? For example, did you do training, mentorship? Did you integrate within the existing health systems? What other approach can you share with us? Also, those aspects of implementation that make this a success, these different approaches that we're talking about.
Okay, so yet the different approaches were nested within the existing service provision, the existing system. We as a program for sex workers are nested within the public health sector clinics. We're co-located there, so it's not a separate program. It has to work within there. And then we did what others have also done, where we're identifying PrEP ambassadors and working with them to be with similar age groups for those we were targeting. So that you don't feel like if you're 16 years old and the PrEP ambassador is 24, like they don't really understand you live at home, they don't. So just identifying PrEP ambassadors who they could relate to, training them to be able to educate their peers, and then be able to create demand doing. So they would also be able to assess risk. We had a risk assessment tool for low risk, medium risk, high risk, so that they're really trying to emphasize linking those who are highest risk to PrEP services. And they would create interest in PrEP, these PrEP ambassadors. And this peer-led creation of demand was very effective because it was someone who can increase your confidence in PrEP. They know that you can do it. You've been able to adhere to PrEP, so you can also address adherence support concerns. There sometimes have been myths circulating. So these peers could address issues about is PrEP safe? Will I have drug resistance? And then this really improved the uptake. So this community delivery was supported by these trained PrEP ambassadors who were able to be linking into the existing system. And then PrEP is delivered in the community, but it really relies on this health education that has happened through the peers and the support for adherence. That demand creation is definitely underpinned by the peers in the community who they can relate to.
Yeah, I think I totally agree on that one as well, because, we need to move away from having different services, running parallel, but we just want to have an integration at the end of the day, because we are talking about an adolescent girl who is a one person, we can layer different services all together. So we really, that approach, I really like it. And also the peer mentorship, it really works because I would really want to understand, experiences from someone who's at my own age, who's also going through the things that I'm also going through. So really, Primrose, I totally agree with you in terms of, training and mentorship, the peer component, as well as integration within the 16 health systems as well. So I'm coming back to you, Joyce. I'm just going to give you 1 minute, and also Tabeleng 1 minute for us to wrap up this session. In terms of, you have also touched about it in terms of experiences of adolescent girls and young women, understanding their preferences and also their needs. Can you share us a bit of, just in 1 minute, in terms of what have you learned in terms of this information, and also how to use this information to influence change at the end of the day? Just 1 minute.
Thank you, Maxi, and I promise I'll keep it within 1 minute. I'll give this like a parting shot in 3 points. I'd say the first one, that young women in all our diversity, we know what works for us, and we are better placed to highlight the barriers to access, and we know better what recommendations work for us, what is likely to work for us. So I can say that there are some young women who already have the capacity to program or to inform programming, but there is need for more ears to listen, and there is need to create more space for young women to be engaged through. That is one lesson that I learned, that young women are perfectly capable of programming for ourselves. The second thing I would say, how I use the information. I, as a person, I use the information that I gather from the young women through the various platforms that I mentioned to inform my advocacy at different levels of my engagement with other implementers. I'd say like I'm sort of like a go-between, an intermediary, and one person who takes the feedback from the ground level to the policy and implementer level, which has been effective for those who definitely care to listen. And I would say finally that I am, with the information that I've gathered, and possibly this is part of one of my fellowship objectives, I am currently developing a policy brief based on the preferences that I have gathered from the young women through the surveys and the communications and consultancies and everything that I've done with young women. And I'm finally putting that together so that the programmers and implementers don't say they don't know what young women want. And because there may not be enough spaces for all of us, we are putting this together in a brief. And that is another way of using the information that I've gathered from young women. And just to implore people that they should be watching out for this, possibly early April. Yeah, I think I'm within 1 minute. Thank you.
Thank you, my dear. Thank you. It's really good to have those different approaches all together. And Tabeleng, you've talked about, your different engagement with the communities and in terms of supporting adolescent girls and young men. What advice can you give us, as we are about to embark on implementing adolescent girls and young women PrEP services at the end of the day? So just 1 minute, can you give us advice that we can also take aboard?
Thank you very much, Maxi. So my one advice is that, yes, as my colleague has said, adolescent girls and young women know what they want, but the thing is they don't have enough information or clear information on how they will get what they want, and parents are ready to support adolescent girls and young women, but they also don't have enough information on this, so that they will where that this is actually important for our kids to be having. So the advice is, let us normalize involving the community and sharing as much information as possible, so that people will understand things and they will be able to willingly want to use these things that are actually provided and made for their health benefits. So that is my advice.
Wow, thank you so much, guys. So this was really a really interesting session. We had so much that we really need to take in. And I just want to understand, we are now want to move to questions. So if we've got your question, please do type in. We might not get to them all today, but we will make sure that we also post them during our email trail, and also during the course of the 5 sessions that we're also going to be having throughout. So one critical one that I really want to hear from Primrose, I know you have answered in the chat box, but I just wanted to understand, when you're talking about PrEP ambassadors, so many people are saying it's a great approach, but if I may ask, this is from one of our colleagues, what is the criteria for selecting a PrEP ambassador? Because I think it's really important as well. Primrose, if you can just share a little bit about that. I know you've answered, but I think for the sake of others to really understand more.
So what we have always in the program is peer educators or micro planners who work at a more intensive level. And within that group, they engage with services regularly, and we knew there are some on PrEP. So from those who we know already can work in the community, who had been on PrEP, and because we wanted people who can support also retention and adherence, we selected those who had been on PrEP for 6 months. So then they were trained so that they can provide health education on PrEP, around side effects and how to link to services, any concerns around adverse events. So they were then provided with training. They're also mentored by an outreach worker within the program, so that if they're needing any support with engaging anybody that they are trying to link to services for PrEP. And then they are paid a monthly stipend. So the peer educators, for instance, get a monthly stipend of $15, and the PrEP ambassador would get the same amount, but their focus would be on demand creation for PrEP. So they did get a stipend, but it's just a token amount, yeah.
Yeah, thank you so much for that, to bring that aspect, of a stipend, because a lot of times, we programmers, we come in and we are forgetting that we are working also with adolescent girls and young women who've got also their own needs, but at the end of the day, they want to engage, but they don't have the means to engage. That's where the barrier really comes into play, to say, if I want to travel from A to B, what do I use? How do I reach my other peer for me to really recruit that? So that aspect of a stipend really, it really comes into play in terms of supporting them be able to reach even wider adolescent girls and young. Go ahead, my dear.
And there's one thing I'd left out. What we introduced last year, because there was difficulty in moving around, was to provide them and other educators with a data and airtime allowance that would be deposited directly on their phones, so that they could communicate virtually. And then they were supported. They established some WhatsApp groups with those that they would, and broadcast lists that they would be sending out information and updating on. And we would be able to track whether they were being used for what we wanted by just seeing how many people do they refer to services. But it really helped because physical contact wasn't always possible now with the COVID pandemic.
Great. Wow, that's a great initiative, especially when talking about COVID-19. It's not a matter of us leaving the services, but we want to continue the services, reaching out to these adolescent girls and young women. So really, thank you for that approach, really. So I'm going back to the chat box. I see that, Alexandra, you've posted a question around, framing PrEP as something positive. And I see, Kumbirai, you have managed to kind of share with us some of the wonderful ideas that you're also doing. Are you able to share with us, Kumbi, in terms of what you are doing, so that we also understand more in terms of around PrEP framing? That is Kumbirai. Let me try to see the surname. Kumbirai Tatora.
Thank you very much, Maximina. Yes, I just wanted to share with Alexandra that we have also realized that PrEP is very much stigmatized, and we are developing a multimedia campaign that will reposition PrEP more as an empowering product and services for young people. And in this campaign, we are using PrEP starter packs, which is a tool, it's more like a cosmetic bag where they can put in their pills so that they are not stigmatized, because as we know, most girls complain about the sound from the pills, that they make a lot of sound, and then people know that you're on PrEP. So we are coming up with a nice starter cosmetic bag that will give out to girls so that it's really part of their lifestyle. Thank you.
Great. Thank you so much, Kumbi. And I'm seeing a lot of questions are starting to come in, and a lot of hands. I see Nomple. So I'll just give Nomple a chance to ask or probably answer. Then we'll definitely have to move to our Jamboard to interact more there. And also just to highlight that these questions are also going to be addressed throughout, through email and all throughout when we are also discussing some other sessions at the end of the day. I'm loving the discussions. I'm loving how we are also sharing different approaches, different modalities, different interventions that we have been doing on the ground as different stakeholders as well. Nomhle, just 1 minute.
Thanks, Maxine. I just wanted to share that, according to one of our recent studies, I'm Nomhle from SRHR. So one of our recent studies, which was an PrEP implementation project at GP's Town and Vets Ward 21, we found that young women prefer to have, triangulated information, like to receive information from different sources. So from when we were recruiting them, the health providers will, or our community healthcare workers will give them information about PrEP. But then we also introduced what we call the decision tool, which was a tablet that was placed in the clinic where they could read and get information about PrEP. And that also seemed to be useful for them to confirm the information that they receive from the healthcare providers and the community healthcare workers. Then also they're seeing this information there, which helped them with the decision to take PrEP. And also what we found was that those who have been exposed to the decision tool were more likely to be persistent, at least for 1 month, to be on PrEP and continue taking PrEP, as opposed to those who were not exposed to the decision tool. So it's really about getting information from the different kind of sources, which also is helpful to create demand. Thank you.
Wow, thank you so much, Nomple. I think that's one other approach that we could also take into account as we are also discussing. I think we'll also discuss more. I'll hand this time to Alice as we are going on our Jamboard. Let's interact more. Please do say in your contribution regarding demand creation, community sensitization, and the adolescent girls and young participation. I'm loving how I'm seeing different ideas, different information. Please do send them in. Alice, over to you.